Dr. Brent Reynolds, professor of neurosurgery at the University of Florida Health at Gainesville, has focused his research on neurostem cells in the brain, which produce new stem cells. His lab slowly evolved into a cancer research facility when they began focusing on cancer stem cells. Now, it's very interesting, and it's a very big word, glioblastomas. Did I say that properly?
Yeah, it is, correct.
Can you tell us what those are and why are they so deadly?
So it's a type of brain tumor. It's also referred to as a grade 4 brain tumor, and quite often we grade cancers based on the seriousness of it, grade 1 being the lowest and grade 4 being the worst. So it's the worst of type of brain tumors to get. It has a terrible diagnosis, and usually time of diagnosis to time of death is somewhere around 12 to 15 months.
The tumor typically shows up in the cortical or outer part of the brain, but it can really be found anywhere. Since brain tumors grow within the skull and are hard to detect, their diagnosis often comes rather late.
And so it's almost always deadly.
It's almost universally fatal. Probably the 5-year survival is 1%, 2% of patients.
And what are the symptoms? How would one know if they might have one of these?
Typically what will happen, so because it's encased in your, in this small little head of yours, this bony structure, is it's not like you get a lump on your skin or something like that. And so you don't diagnose it till you get some sort of neurological deficit. So you might be getting really bad headaches, you might have vision problems, patients will have seizures, you may have some motor difficulties. You go into the doctor, they do a brain scan, and they see this great big tumor sitting there.
Dr. Reynolds has discovered that a specific diet appears to slow the growth of progressive brain tumors in mice. What feeds into the tumor's growth? Are they sugars and that makes the tumors start to grow?
So there's a lot of things that do that. One is the genomics of it. So pathways that cause cells to grow, pathways that tell cells to stop growing are dysregulated in cancers, in most tumors. However, one of the things that tumors use, they blow through tons of glucose. The reason tumor cells go through a lot of glucose is they're just metabolically active, like crazy, right? These cells are like dividing.
And so that brings us to sort of your findings where if you regulate glucose in your diet, it can probably help with tumor growth.
That's the hypothesis, right? To say whether that's 100% true. That's what we're studying. That's our hypothesis, and we're trying to test that. This is what got us started, several years ago, 5 or 6 years ago, on what was known as the ketogenic diet. It was developed in the 1920s. It was used for kids with epilepsy, and found that when kids were put on this diet, their epilepsy did better. So that basically started sort of a small revolution where scientists like myself start looking at the ketogenic diet in cancer and saying, why is this helping?
And how does it define help? What does it do to help?
It slows down tumor growth.
Okay.
Now the ketogenic diet is kind of like fasting. It mimics fasting in many ways. So it's really low in carbohydrates, like 10%, 3%. Really high in fat, like 80, 90%, and then a little bit of protein.
Which it almost seems to go against every diet that we're told is good. We're always told fat is bad, yet it's the highest levels is in the ketogenic diet. Why is that?
So that general statement is just wrong.
I didn't make that
to start
statement.
with.
That's the preconception.
But taking that out of the equation, two things happen when you go on the ketogenic diet. At least two physiological things happen. Number one, because you don't have many carbohydrates, your glucose levels come down. Because your diet is high on fat, what happens is those fats gets processed and makes these things called ketone bodies. And so your ketones go up, your glucose comes down. 1950s, 60s comes along. Some anti-epileptic drugs come onto the market, and obviously ketogenic diet falls out of favor because the ketogenic diet looks like bacon and eggs, 3 meals a day, forever.
Which sounds good for a couple days.
Not bad
Not
for a
forever.
couple days, but not forever. It's really tough to do.
Dr. Reynolds decided to research ways to improve the palatability of the diet by manipulating the levels of carbs and fat. He eventually stumbled upon something called medium-chain triglycerides.
And so most fats, when you consume them, they go into your gut, they go to your lymphatic system, they go into your blood, and then they get processed through your liver. Medium-chain triglycerides, they go into your gut, they go directly to your liver via the hepatic portal vein, and they get processed and they get turned into ketones.
MCT is found in things like coconut oil.
But you couldn't just consume coconut oil and get the same effect of the medium-chain triglyceride. So it's kind of like a concentrated form of extract.
Now that Dr. Reynolds was able to mimic the ketogenic diet, he and his team wanted to see if they had the same effect on tumors.
So we treat some animals with the ketogenic diet. We treat some animals with our high-fat, low-carb diet. And the two animals live about 3 times as long as the untreated animals. And it actually mimicked identically the ketogenic diet.
So how does a person take advantage of these natural therapies? For starters, go on the Atkins diet because limiting your carbohydrates is the first step toward ketogenic results.
At the same time, you would take a medium chain triglyceride. And so, there's an oil you can buy. There's actually a company that sells a powder. What you would actually find is when your carbohydrate levels come down from being on the low carbohydrate diet, and then you take the medium chain triglyceride supplement, your ketones go up. And so, they will go up, within like a half hour after consuming the medium chain triglycerides, your ketones go up.
By doing this, you are lowering the primary energy source for tumor cell growth.
It's not a cure for cancer at all, but it's something that can help shift that balance in favor of slowing down the tumor growth.
And the best part is that unlike chemotherapy, there are no side effects from this simple diet change. Do you know if it's effective in other cancers, or has that been tested yet?
We've looked at some other cancers. So we've looked at lung cancer, colon cancer, breast cancer, and we see the same kind of effect. It's not going to be good for everything, but we think it's going to be helpful for a lot of cancers.
And so you say the next step is the approval process for human trials?
Yeah, so that's what we're doing right now. So we're working with a group at John Wayne Cancer Center in Los Angeles. Okay. We're working with our neuro-oncology group here at the University of Florida. And we're working with a neuro-oncology group at Tufts University. So what we're wanting to do is have a small consortium where we can now go formally test this in a patient population to say, is this going to be helpful?
And the great thing about all of this is because it's just a diet, not only someone with cancer, but your average person, anybody can just start eating like that and circumvent your human trials and all of that stuff, because that's a process, of course. This is something they can start doing today.
Absolutely. So anyone could do this. What they're finding with the ketogenic diet is not only does it show clear benefit for people with epilepsy, but now they're starting to look at things like how it may benefit people with stroke, how it benefits kids with autism, how it benefits Parkinson's disease, Alzheimer's disease. So there's also this very neurological focused benefit of the ketogenic diet.
Dr. Reynolds and his team of incredible researchers at the University of Florida Health have shown that a simple diet change today can affect your health tomorrow.
Well, thank you, Dr. Reynolds, for taking part in our show and letting us know about this technology that's shrinking brain tumors through a proper diet.
And a diet that anyone can start today.
Yeah, thank you so much.
Thank you very much for coming by.